Hello, are you the dental hygienist?
Yes, I am Sparkle, the dental hygienist.
I'm Snaggletooth and I want to get my teeth whitened.
Snaggletooth, I would love to help you with getting your teeth whitened. Have you had your teeth whitened before?
No, I have not.
Well, Snaggletooth, we will first need to determine if you are a good candidate for teeth whitening.
What does that mean?
If you have a lot of calculus buildup or caries, or if you have sensitivity, you might not be a good candidate for teeth whitening.
How do you find out if I am a good candidate for teeth whitening?
I'm very glad you asked. I have a process to follow, Snaggletooth. It is the dental hygiene process of care.
The dental hygiene process of care? Tell me about that.
There are several steps to the dental hygiene process of care. The first is to assess. This means to gather information and collect data. You and I will be partners in this. We will review your medical health history and complete a periodontal assessment which will include radiographs, probing depths, tissue descriptions, bleeding points, and will include any other periodontal markers which might be evident.
What is the next step?
The next step is to diagnose your periodontal condition. This will be determined based on the information gathered whether you have gingivitis or a level of periodontitis.
Are there more steps to this process of care?
Yes. After we have completed the assessment and made a diagnosis, we need to begin planning your treatment. We will decide if you are a candidate for a regular prophylaxis or if you might need non-surgical periodontal therapy or possibly a referral to a periodontal office. Once we have finished planning your treatment, and once I have explained to you all of the risks and benefits as well as explained other treatment choices, I will ask you to sign an informed consent form if you agree to the treatment we have planned.
And then what comes next?
At this point we will be ready to implement your treatment plan. This means we will be able to begin with whichever treatment modality we have determined to be best for you at this time. We will also discuss home care strategies for you to use in the prevention of periodontal disease.
Then we're done. I can then have my teeth whitened.
Once the doctor has completed your exam and if he determines that you do not need any restorative work, and if you respond well to whichever periodontal treatment we have done, it is likely you will then be able to get your teeth whitened.
Does this mean the last step is evaluating whether the treatment is a success?
Yes, the last step is an evaluation of whether we have planned an appropriate therapy for you and if the home care instructions are sufficient to address your needs. However, throughout the entire process, I will be documenting my findings in your patient chart.
Wow, you were right, this process of care has several steps. What were they again?
One last time: assess, diagnose, plan, implement, evaluate and always document.
Sparkle, do not forget about the reason I came here today.
Snaggletooth, teeth whitening is your primary concern and we will be discussing it throughout your appointment. Come, let's get started on your assessment.